Hello, my name is Joshua White, and I will be discussing with you briefly data mining software within the healthcare industry. To give a little background information, today data mining is used all around us. The term was actually coined back in the 90s. Healthcare facilities are spending millions of dollars to leverage the benefits of this software. They are using the research that they gain to improve their operations and to save lives. So, what is data mining software, or simply data mining? Data mining is exploring massive amounts of data to find hidden patterns, trends, and relationships. The software then creates models to help explain these findings. Data mining is often defined as a combination of classical statistics, machine learning, and artificial intelligence. However, data mining is not any of these individually. The history of data mining. William Farr, a leading epidemiologist, was appointed to the General Registrar's Office in London. His most important contribution to public health was setting up a way to routinely record deaths. He then used this to link the mortality rate of certain professions. John Snow, also known as the father of epidemiology, used his findings on cholera to prove that it was a waterborne illness and not an airborne illness as previously thought. This is important because it introduces the idea of finding hidden patterns in vast amounts of data, or medical data. Moving on, electronic storage came along in the 1960s. Hospitals began storing their data on computers around the 1970s. Hospitals' computer systems are uniquely identified as hospital information systems or health information systems. They are used to store the data, retrieve, and manipulate it. As computer power, storage, and algorithms evolve, we were able to use data mining software as we use it today. So, how does the data mining software work? According to Colonel Robb and Morris, the authors of Database Systems Design, Implementation, and Management, data mining has 4 different stages. First is preparation, then there is data analysis, then knowledge acquisition, and finally, prognosis. Getting data ready. Data mining is made possible by efficient data management. Data is managed efficiently on health information systems by creating a database. Data is normally entered into a database by a data entry clerk or by a nurse or physician operating an EHR. The data can be organized even further from here into a data warehouse. A data warehouse is basically a much more detailed database made for a specific purpose or department. Once the data is ready and organized, or in the data warehouse, the data analysis takes place. Data analysis can be best described as the way the researcher wants the information to be analyzed. According to D. Burks of WiseGeek.com, there are 4 common types of data mining analysis: exploratory data modeling, descriptive data modeling, predictive data modeling, and pattern discovery and rules. Exploratory data modeling connects variables out of the database that are selected by the researcher and attempts to find some common way to bind those variables. Descriptive data modeling synthesizes entire data sets into clusters or segments. It is good for finding trends. Predictive data modeling uses the information in a database to predict a certain outcome or new variable. And pattern discovery in WOOLS does not work with an underlying database or data warehouse. Rather, it analyzes raw data directly for trends or patterns. The data analysis is made possible because of algorithms. Two predictive modeling algorithms are the decision tree algorithm and the neural network algorithm. This is how a decision tree works. It starts with a situation or condition and from there branches out according to each outcome. This example shown predicts the likelihood that someone will abstain from smoking after some type of treatment, maybe rehab. The neural network algorithm is much more complex. I simply put this just to show that algorithms can get extremely complex. Neural networks have been used in urine tests and image processing. The algorithms that I've just shown are just a couple, but they are how the data mining software is able to do data analysis. Once the preparation and analysis have occurred, it is now time for knowledge acquisition and prognosis. Prognosis is just the possible course of action or outcome from the knowledge you gain. Prognosis in medical terms refers to probable outcome of a disease, but I'm not limiting myself to just that in this case. For the data mining software, the end result will look something like this. This is an IBM software called SPSS Statistics. It is being used in this case by health insurers. Each node could represent a company that the health insurer represents or an employee that the health insurer represents. And this data can be used in order to create more customizable packaging and retain customers. Next, we will look at an EHR that has performed data mining analysis. This is from a company called Ubiquity. As you can see, it is aiding the physician or nurse in diagnostic support. What is gained and results from this information is truly on a researcher and how he wants to use it. This is an example of the entire process. From the HIS, a database is formed, the data warehouse is formed from the database, and the analysis happens, which equals knowledge for the user or researcher. Now, let's discuss more current uses of data mining in healthcare. Many uses, as you can see. Data mining is needed because, as stated, doctors and healthcare facilities don't always have the time or means to properly analyze all the data set before them. Through EHRs like the one we just saw, data mining can aid in diagnostic support and even treatment options. Furthermore, data mining is used to improve the quality of care a healthcare facility provides. Data mining is used to track patterns that give way to medical insurance fraud and abuse. Furthermore, physicians can use it to monitor and improve the process of their revenue cycles and to improve relationships among certain customers. This is simply a few of the popular data mining softwares available on the market today. These are popular EHR brands. Let's look at the future of data mining in healthcare. The current uses, aiding medical compliance, diagnostic support, and treatment options will continually be improved, along with healthcare facilities improving the quality of health for patients. We should expect more aggressive preventive services. Furthermore, computers like IBM's Watson will be able to mine health data from a voice command to find treatment options and to support in diagnostics. Watson even won a round of Jeopardy when it came on the show. Researchers are also aiming to effectively analyze genes to find patterns that lead to disease formation. Lastly, I would like to briefly discuss privacy issues. Many patients are afraid their data will be exposed during mining, but HIPAA has clear-cut security and privacy measures in place, and if not followed, could result in fines or even loss of accreditation. Even for those who can mine data for research, like government agencies, there are techniques used to hide personal identifiable information. That is my presentation. I hope you were informed and enjoyed. Thanks.